Hello everyone and welcome back. In today's teaching, we're going to be discussing the elbow joints. And as discussed in the last class, a joint is a location where they meet. So essentially, the elbow joint is the location that connects the forearm to the arm. So I'm going to be using this outline. We have the bones involved, we have the types, the movements, the muscles, ligaments, blood supply, and the nerve supply. So let's start by highlighting the bones involved. There are three main bones involved in the formation of the elbow joints, and they are the humerus, they are the radius, and the ulna. So you have three bones that forms the elbow joints: the humerus, the radius, and the ulna. So let's move straight to the articular surfaces. And by articular surfaces, we mean that the exact location of these bones that form the joint. So the articular surfaces, there are two. We have the humero-ulnar and the humero-radial. And by humero-ulnar, we are saying that the humerus and the ulna, and the humero-radial, we have the humerus and the radial or the radius. So for the humerus, we have the capitulum and the trochlea, and for the ulna, we have the trochlear notch and the olecranon process. So the humero-ulnar is formed by the capitulum and the trochlea of the humerus, and for the ulna, we have the olecranon process and the trochlear notch. And for the humero-radial, we have the humerus and the head of radius. So here is the radial head. So having discussed that, let's move straight to the type, movements, and the muscles involved in the elbow joint. So the elbow joint is an hinge type of synovial joint, and as such, it is responsible for flexion and extension. I want to responsible mean that the movement that are possible in the elbow joint is flexion and extension. So here is flexion and here is extension. But due to the movement of the radial head, supination and pronation is also possible in the elbow joint. So here is supination, that is the palm facing upward, and pronation, it's facing downward. So in summary, we have four types of movement that are responsible in the elbow joints: are the flexion, we have the extension, flexion, we have extension, we have flexion, we have extension, and we have supination, and we have pronation. So the muscles involved in flexion and extension, they are the biceps and the brachialis, and for extension, we have the triceps and the anconeus. So let's move straight to discuss the ligaments. Ligaments are connective tissues that connect bone to bones, and they also contribute to the overall stability of a joint. So for the elbow joints, we have two. We have the ulnar collateral ligaments and the radial collateral ligaments. So the ulnar collateral ligaments is located medially, while the radial collateral ligaments is located laterally. So the ulnar collateral ligaments help to resist what we call the valgus stress, and the radial collateral ligaments help to resist what we call the varus stress. So having said that, let's move to the capsule. So we have the loose anterior and the loose posterior in the elbow joint. After that, let's move straight to the blood supply. The elbow joint is supplied by a rich blood supply, a rich anastomotic blood supply, but that will be discussed in the next class, because the anastomosis around the elbow joint that supplies it is very rich, and it should be a main topic on it. So having said that, let's move straight to the nerve supply. For the nerve supply, we have the musculocutaneous nerve, we have the radial nerve, and we have the ulnar nerve. So in summary, the elbow joint is a very important joint with three bones involved: the humerus, the radius, and the ulna, with articular surfaces being the capitulum, the trochlea, and for the ulna, we have the olecranon process and the trochlear notch. So for the radius, we have the radial head, and it is a hinge type of synovial joint that allows for flexion and extension, and also for supination and pronation. So two ligaments, the ulnar collateral ligaments medially and radial collateral ligaments laterally, the loose anterior and loose posterior, they are the capsule, and the muscles involved, they are the biceps and brachialis for flexion, and the anconeus and triceps for extension. The blood supply is by an anastomosis network by the brachial artery, the radial, and the ulnar branches, and the nerve supply is by the musculocutaneous nerve, the radial nerve, and the ulnar nerve. So I believe that with this, you understand the elbow joints. And do also subscribe. If you have further questions, don't forget to drop them in the comment section. Thank you so much. I'll see you next class.